I'm going to explain something that affects millions of people every night, but most have no idea it's happening. You wake up with a sore neck, dry mouth, or feeling tired despite sleeping 8 hours. The culprit? You're breathing through your mouth while you sleep? As a doctor, I see patients daily who think their neck pain is from their pillow or mattress, when the real problem is happening inside their mouth and throat. Today, I'll explain the exact medical mechanisms behind why mouth breathing destroys your sleep quality and changes your face over time. And most importantly, how to fix it. What happens when you sleep with your mouth open? When you breathe through your mouth during sleep, your tongue drops backward and downward. This isn't just about comfort, it's about physics and anatomy. Your tongue normally rests against the roof of your mouth, creating what we call proper oral posture. When your mouth falls open, several things happen simultaneously. Your tongue falls back toward your throat, narrowing your airway by up to 40%. Your jaw drops down and back, pulling on the muscles that connect to your neck and upper spine. The hyoid bone, a small bone in your throat that anchors your tongue and throat muscles, shifts downward, creating tension throughout your neck. The muscle chain reaction. Here's what most people don't understand. Your jaw, tongue, and neck muscles are all connected in what we call a kinetic chain. When one part moves out of position, everything else compensates. The muscles that hold your jaw in place, your temporomandibular muscles, have to work overtime to keep your mouth open all night. These muscles attach directly to your temporal bone near your ear and create tension that radiates down your neck. Your sternocleidomastoid muscle, which runs from behind your ear to your collarbone, tightens to compensate for the changed head position. Your upper trapezius muscles, running from your neck to your shoulders, also contract to maintain stability. The forward head posture connection. When you mouth breathe, your body automatically adjusts your head position to maximize airflow. Your head moves forward and tilts back slightly, what we call forward head posture. This position increases the load on your cervical spine by 10-15 pounds for every inch your head moves forward, forces your neck muscles to work against gravity all night long, creates compression in your upper cervical joints, leading to morning stiffness and pain. The oxygen debt effect. Mouth breathing delivers 10-20% less oxygen to your bloodstream compared to nasal breathing. Here's why your nose warms, humidifies, and filters air, while also producing nitric oxide, a molecule that improves oxygen absorption in your lungs. When you mouth breathe, you're essentially running on reduced oxygen all night. Your heart rate increases slightly, your nervous system stays more activated, and your muscles don't fully relax. This chronic low-level tension contributes to neck and shoulder stiffness. Sleep quality disruption. Mouth breathing fragments your sleep in ways you don't consciously notice. You might think you slept through the night, but sleep studies show that mouth breathers have more frequent micro-awakenings, brief moments where your brain partially wakes. To address breathing difficulties, reduce time in deep sleep stages, which is when muscle recovery happens, higher cortisol levels leading to increased muscle tension and slower healing. The long adenoid face syndrome, chronic mouth breathing, especially from childhood, literally reshapes your facial structure. This condition, called long face syndrome or adenoid face, involves your upper jaw narrows because the tongue isn't pressing against the palate to maintain its width. Your lower jaw grows longer and more recessed, creating an overbite. Your face becomes longer and narrower overall. Adult facial changes. Even if you start mouth breathing as an adult, changes occur over months and years. Your cheekbones may appear less prominent as facial muscles weaken. Your jawline becomes less defined due to poor muscle tone. Wrinkles form around your mouth from chronic open mouth posture. The tongue posture problem. When you breathe through your mouth, your tongue can't maintain proper contact with your palate. This affects facial support. Your tongue acts like an internal scaffold for your face. Jaw development. Proper tongue posture guides healthy jaw growth. Airway size. A well-positioned tongue keeps your airway open and stable. Dental and oral health. Mouth breathing creates a cascade of oral health problems. Your saliva evaporates rapidly, reducing its protective effects against bacteria. Your mouth's pH becomes more acidic, promoting tooth decay. Your gums dry out, leading to inflammation and gum disease. You're more likely to develop bad breath, cavities, and oral infections, sleep disorders, and breathing issues. Mouth breathing often indicates or leads to more serious sleep disorders. Sleep apnea becomes more likely as your airway becomes unstable. Snoring increases due to vibration of relaxed oral tissues. You may experience frequent night wakings due to breathing difficulties. Cognitive and energy effects. The reduced oxygen delivery from mouth breathing affects your brain function. Morning brain fog becomes common due to poor sleep quality. Concentration and memory problems develop from chronic sleep fragmentation. Daytime fatigue occurs despite spending adequate time in bed. Morning symptoms. Dry mouth or sticky saliva when you wake up. bad breath despite good oral hygiene, sore throat or scratchy feeling in your throat, neck stiffness or headaches, feeling tired despite sleeping enough hours, physical signs, dark circles under your eyes from poor sleep quality, chapped lips or cracks at the corners of your mouth, forward head posture when standing or sitting, narrow nostrils or a deviated septum. The tape test. Here's a simple test before bed. Gently tape your lips closed with medical tape. If you can sleep comfortably, you're capable of nasal breathing. If you feel panicked or can't breathe, you likely have nasal obstruction that needs addressing. Immediate fixes. Nasal breathing training practice. Breathing only through your nose during the day. Set reminders to check your breathing every hour. When you catch yourself mouth breathing, consciously switch to nasal breathing. Mouth taping. Use specialized mouth tape designed for sleep or medical tape. Apply gently across your lips. Start with just the center of your lips taped, leaving the corners free. This trains your body to breathe nasally without feeling claustrophobic. Sleep position. Sleep on your side, rather than your back to keep your airway more open. Use a cervical support pillow that maintains your neck's natural curve. Elevate your head slightly to reduce nasal congestion. Addressing nasal congestion. Salinariensis. Use a neti pot or saline spray before bed to clear nasal passages. Add a pinch of baking soda to reduce irritation. Humidity control. Keep your bedroom humidity between 40–50% to prevent nasal drying. Use a humidifier if necessary, especially during winter months. Allergy management. Identify and avoid allergens that cause nasal congestion. Consider air purifiers for your bedroom. Wash bedding in hot water weekly to reduce dust mites. Professional treatments. ENT evaluation. See an ear, nose, and throat specialist to check for structural problems, like deviated septum, enlarged turbinates, or nasal polyps. Myofunctional therapy work with a trained therapist. To retrain your tongue and facial muscles. Learn proper swallowing patterns and tongue posture. Dental interventions. Consider orthodontic treatment if jaw alignment contributes to breathing problems. Palatal expansion can widen your upper jaw to improve nasal breathing. Tongue and throat exercises. Tongue posture training practice keeping your tongue pressed against your palate throughout the day. The tip should rest behind your front teeth with the middle and back of your tongue spread wide against the roof of your mouth. Throat strengthening. Sing, hum, or practice. Vocal exercises to strengthen throat muscles. These exercises improve muscle tone and reduce the likelihood of airway collapse during sleep. Lifestyle modifications. Weight management. Excess weight around your neck can compress your airway and force mouth breathing. Even modest weight loss can significantly improve breathing patterns. Exercise regularly. Cardiovascular exercise improves your overall respiratory efficiency and can reduce nasal congestion over time. Stress management. Chronic stress increases muscle tension and can worsen breathing patterns. Practice relaxation techniques, meditation, or yoga to reduce overall tension. Mouth breathing isn't just a harmless habit, it's a medical issue that affects your sleep, your health, and even your appearance. The good news is that with proper understanding and consistent effort, you can retrain your breathing patterns and eliminate the neck pain and other symptoms you've been experiencing. Start tonight with mouth taping if your nasal passages are clear, or begin with nasal congestion treatments if needed. The changes won't happen overnight, but within 2 to 4 weeks of consistent nasal breathing, most people notice significant improvements in their sleep quality, energy levels, and morning neck pain. Remember, if you can't breathe comfortably through your nose, there's usually an underlying cause that can be treated. Don't accept mouth breathing as normal. Your body is designed to breathe through your nose, and when you restore this natural pattern, everything else begins to fall into place. Your health and well-being matter, and small changes like this can make a huge difference in how you feel every day. Thank you so much for watching and taking the time to learn about your health. Sweet dreams and pain-free mornings ahead.